So with the Cargill outbreak, we did respond to that, my colleagues at Alberta Health Services, and there had been a previous exposure at another meatpacking plant that was responded to, and so the same kinds of precautions were implemented at Cargill as had been successful in this previous plant. And I think, as I've said before, one of the things that happened in that early response was that we focused on the site very specifically, and that, as time went by and we saw the case, the epidemiology curve, it became clear that there likely had been some exposures at the site before the outbreak had been declared. And with that early outbreak investigation that happened, the responses that were put in place were really focused on making that site safe to work at going forward for the workers. And advice was provided, but there was no supports that were provided to the workers in the initial response in a comprehensive and robust way. So with respect to the response that further went on after it was identified that we can't just provide advice, we need to make sure we provide supports. There was a team of several hundred people that was put together with respect to Cargill and made sure that every single worker had an individual phone call for clinical support if they were to have experienced any symptoms, that testing was made sure to have happen, and that any worker who was having challenges in isolation was provided with supports to do so at no cost to themselves. And also making sure that if there were any other supports that household needed, that they were offered those supports, again with supports in additional languages if that was required. We did then, when there was an outbreak identified in JBS, offer the same kinds of comprehensive supports. But what I will point out with respect to these outbreaks, from the information I've received from my colleagues in Alberta Health Services, is that, again, if we focus only on the site, we will fail, because these are not simply site outbreaks. There is absolutely a site component, but the intertwined nature of the communities, the sites, the families who live in large households, this is absolutely not the fault of the workers. However, it is reflective of the fact that when you have an outbreak in people who are living, working very hard, often working multiple jobs, with intertwined families working in different sectors, that virus spreads very quickly, and that's what we've seen in these outbreaks. I will also say that our testing, I'm not sure what other sectors have done, but we have offered testing to every single worker at these sites. And so with respect to finding additional cases and having an increased case count, we haven't sat back and waited until people develop symptoms. We have offered testing to everyone because we know that there can be some asymptomatic people. So I believe that some of the increased numbers that we've seen at these plants have been the fact that we've aggressively gone after cases so that we have a better opportunity to control the spread in every single setting where workers are spending time. And again, we can't focus just on a site. We are taking those lessons that we've learned in those sites, we're applying them to other sites. And I mentioned in my speaking notes that we do have other sites, other meat processing facilities, where we've done that aggressive intervention at the first case, and we've seen remarkable success. So I think that absolutely these workers have suffered, and I think that it's really important to not stigmatize them. It is not their fault, but we also need to make sure that they get every single support they need, and that's what's being offered.